So again, welcome to our webinar, Scope of Work, Skills, and Roles of Community Health Workers. Today we're going to be talking about, the growing field of community health workers, the importance of how they're used and how they can be used to reach folks from marginalized communities. We're going to talk even more specifically about how community health workers fit into the mental health system and mental health services. And we're going to even further contextualize it by talking about how community health workers are increasingly a really important part of supporting people during the pandemic. So I want to introduce you all to our presenter, our wonderful presenter, Dwyan Monroe. As Program Coordinator of CHW initiatives within the Institute for Public Health Innovation, Dwyan is part of a team that designs, plans, and delivers training and technical assistance for programs, institutions, and health systems, incorporating CHWs and outreach initiatives in the Washington, D.C., Maryland, and Virginia region. A former community health worker and current CHW master trainer, Dwyan has nearly 36 years of experience as an advocate for the community health worker profession. Dwyan's a graduate of Hampton University with a Bachelor of Arts in Psychology. She's completed numerous certificate programs in public health leadership, community and clinical health outreach, and community-based program development. And with that, I will turn it over to Dwyan to share this really important information with us all today.
Thank you, Kelly, so much. I want to thank Kelly and Mental Health America for the opportunity to share some really information that's near and dear to my heart. As an advocate, a master trainer, and a former community health worker, how important the role has evolved and will continue to evolve to play a very integral part in how public health and healthcare will support the communities that are needed the most. So I'm bringing to you just a small piece of some of the initial core skills training that we provide our community health workers when we onboard them. We're going to talk about the scope and role and skills, and then I'm going to get more into the meat of who they are, how they work, who they work with. Some of you may or may not be familiar. Some of you may have worked with community health workers, and if you already have, you already know and understand how important that role is and how it has enhanced other providers' roles in reaching the necessary communities that need them the most. All right, so the community health worker. This is the full definition through the Federal Registry Bureau of Labor Statistics. This came together from HRSA and CHW section of IPHI, which has proposed a new classification. It is a frontline public health worker who is a trusted member, and there are certain words that you'll see kind of highlighted, and I'll talk about those as I go along. Who is a trusted member of and or has an unusually close understanding of the community served. This trusted relationship enables the CHW to serve as a liaison link intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competence of service delivery. A community health worker, CHW, also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. So this is the actual definition that you will find through the Federal Registry of the Bureau of Labor Statistics. With this, you may have heard of other titles relating to this. Community health worker is like the umbrella title for other titles such as community health advisor, promotora de la salud. Different types of titles that you hear that are based on either the organizations they represent or the employers that employ them. But they all come under the title of community health worker. And so we want to talk about basically where and how they work. They work in all geographic settings. We talk about rural and urban, metropolitan areas, border regions. And in these communities, they play an integral role in helping systems become more culturally appropriate and relevant to the people that they serve. CHW's roles, they vary depending on where they're located and the cultural setting that they support. They are most often found working in communities where people have limited access to resources, access to quality health care, lack the means to pay for good quality health care, not speak English fluently, and have cultural beliefs and values and behaviors that differ from those of the dominant Western health system. CHWs typically have deep roots and shared life experiences in the communities that they serve. They share similar values and ethnic background and socioeconomic status, and they often speak the same language as the people that they serve. Their expertise is based on that shared life experience, understanding that they have been there too, or they know a family member who has been through a similar struggle when it comes to not just accessing health care, but food, housing, good jobs, income, and often culture and community and health with people that they serve. They sometimes relate to community members as peers rather than purely as clients or patients. They rely on relationships and trust more on those relationships than the clinical expertise. They do not provide clinical care, nor do they diagnose anyone with any type of disease state. Generally, they do not hold a professional license, but they are certified in some places. And just to talk about my region, Maryland and Virginia actually have, in the past year and a half, incorporated community health worker certification. They're both in their grandparenting stages of bringing on community health workers who have been trained and worked within their communities for over 2 to 3 years. And they can achieve certain results that often other professionals can't. And we're not saying that they replace other providers, but a lot of times these community health workers, because they have such a close relationship and they share their experience, they can get patients to actually show up for appointments, take their medicine, and adhere to a lot of the doctor's treatments when normally that hasn't been able to happen for various reasons, and we'll talk about that moving forward. So the scope of practice for community health workers. As any profession, they have a scope of practice. They have core skills that they have to be trained. The unique thing about the scope of practice and training, and myself as a master trainer facilitator, is we utilize their lived experience to address these scopes of practices and how they can work within the context of either alongside a provider, within a community-based setting, a clinical setting, or even a health education and hospital setting. Cultural mediation among individuals, communities, and health and social service systems. CHWs, the work that they do, at least 70–80% has nothing to do with whether they have a patient as a doctor or they're taking medicine. They work within the social determinants of health and understanding that 70% of how someone lives determines how healthy they're going to be. And so they do that by providing culturally appropriate health education and information in that person's given language or how they are able to learn. They work with care coordination. Sometimes they do case management as well as helping to definitely navigate the health system. They provide coaching and social support, advocating for individuals and communities. They also build individual community capacity. As a trainer, the one thing that I say to the CHWs that I train is your role and your goal is to train people to become their own health advocates, that they are not enabling people to need them, but they are teaching people to be able to take care of themselves. And so this is different than some of the providers that we see that the patient needs to have that person either make appointments for them and do things for them. CHWs are training community people to take care of themselves. This is what they do. And they, in turn, hopefully are building that capacity within their community to become their own health advocates, to advocate what they would need within their communities to be healthy and thriving. Sometimes they do provide direct service. CHWs have been trained alongside of the regular core skills of training in phlebotomy as a specialty, taking blood pressures, doing glucose finger sticks, but all have been under direction of either nurse manager or healthcare provider that is licensed. CHWs do not work alone. They're not autonomous. They are always a part of a team or a group of providers that works with an individual as a well-rounded understanding of who that person is and not just that that person has a disease. They implement individual community assessments definitely conduct outreach. And that could be through home visiting. It could be through events that they are tabling. Also, it could be just street outreach, just out throughout the community, connecting and getting to know, but also providing information and services that people would need in the long run. And they participate in research and evaluation. My role as a community health worker years ago, I played a role at Johns Hopkins working in research as a CHW. So my role as a community health worker also had a research component and looked at evaluating different processes of how and why a community health worker would work alongside a nurse practitioner and a cardiologist. So core skills. So when we talk about, yes, their lived experience is a big part of how they will do their job. But what we take is that lived experience and we apply some techniques, some tools, and information so they are able to be effective in working with their clients and patients, as well as working with the teams and providers that they're going to connect their clients and patients to. So communication skills. So when we talk about a full breadth of a core curriculum for training CHWs, out of any case study that came out in 1999, 2000, where 130 CHWs were interviewed about what are the core skills, minus not just looking at the specific disease states, so what are those core actual skills that a community health worker would need to be effective. And then they can be trained, if need be, on certain specific disease areas like diabetes or cardiovascular disease or asthma or HIV. Communication, interpersonal relationship building, service coordination, capacity building skills, advocacy, education and facilitation. CHWs also run support groups. They facilitate projects and community groups, individual community assessment skills. They have the ability to do assessments within the scope of working with the provider and understanding how to incorporate things like motivational interviewing to support behavior change to move from one place to another, outreach skills, professional skills and conduct, how to show up in the community, but also how to show up at a meeting at a health facility and understand that they are basically that liaison and they need to be able to operate in both communities effectively and professionally. Evaluation, again, and research skills. We find a lot of community health workers are working in this area field around things like PCORI. And then knowledge base. They have to be trained to understand the basics of certain diseases, understanding things, and be trained in first aid, be trained in CPR, but also understanding chronic disease self-management, healthy eating, active living, and having the knowledge of the disease area that they're working in with their clients, whether it be hypertension, heart failure, or HIV. The need for the role is great. Healthcare is so changing, and we've seen how it actually has changed the world in the last few months. And so the focus, we know, is more on the consumer's needs and interests. And often it's located more in the home and in the community. We're not always just seeing health needs met within the clinical setting. And realizing that because the trajectory of how our country is changing, that we have to be more culturally sensitive and aware. CHWs are trained in cultural humility, not necessarily cultural competence, realizing that no matter how much I am trained in a particular race or ethnicity to understanding their culture, each individual person has their own way of living, acting, and learning, and I need to understand that in the context of me the CHW helping them around things like health disparities, which we know have been profound and persistent. So strategies like CHWs have been proven evidence-based to be invaluable to save money, save lives, and save money not just for the organizations who employ them, but also for the patients who are being trained to navigate the system to spend less on copays, to understand how to better get a better buck for their medicines, and to understand and see the connection between when I eat better, when I have better housing, I live better, I'm healthier. Hence, I know how to not be so vulnerable and to succumb to the diseases that I may have. CHWs bring a capacity of effectiveness to the health workforce and represent entry into certain career pipelines. And we know institutions are increasingly recognizing the role as critical in engaging, particularly in primary care, and now reducing hospital readmissions. They also assist with individuals and communities to adopt healthy behaviors. They do this through promoting motivational interviewing and getting communities to understand behavior change. They are trained to understand when a person's in a certain in the behavior change wheel, where they are and how to promote them to move along that wheel. They conduct outreach to implement programs in the community that promote, maintain, and improve individual and community health. They provide information on individual resources. They advocate for individuals and the community's needs. So community health workers are the eyes and ears for and with the community, and I say with because at some point, while they are teaching and while they're supporting clients to understand the importance of managing and taking care of their health, they are gradually going to move away from their client to hopefully be self-sufficient. They provide services sometimes such as first aid and, again, blood pressure screening, and collect data to help identify community health needs. So characteristics, and I think this is important. I've been challenged many times on what and who a CHW is. This is not a role for anyone. We're not taking the place of any other health professional, but understanding the unique role that they play, being that trusted person of the community. So within the community, good characteristics that we look for: definitely empathetic, open-minded, and non-judgmental. One of the things that we do in our training is we have an opening module that's about a 2-day module that talks about your values. It talks about humanity, humility, race, stigma, stereotypes, and realizing that the context of why community health workers are needed are rooted in a lot of inequality and inequity. And what does that mean? And making sure that your circumstance as a CHW being trained does not mean that everyone should follow how you've lived and how you've been raised. So understanding things like flexibility and adaptability, caring, motivated, capable of self-directed work, because of community health workers, they spend most of their time out in the community in the field. They're not necessarily behind desks. They're not always doing outreach through phone. And understanding that they're respectful, honest, compassionate, open and eager to change and learn and grow, persistent and creative, and definitely connected to the community in some way. Strong and courageous, definitely friendly and sociable. So these are unique characteristics that when we look for hiring community health workers, and if you're looking to hire one, you want to see a mix of this along with the building of the skill. There are different models that CHWs are a part of. Implementora de la Salud, or lay health worker model. These community health workers are members of a targeted population, sharing their social, cultural, and economic characteristics. So for this model, it is important and it is necessary that that community health worker actually comes from the communities that they're going to be supporting. Speak the language, understand what's happening within the community, and the context of how they're going to be delivering information and supporting their clients. And then you have the member of a care delivery team model. This was the model that I used to be on as a community health worker working with a nurse practitioner and a cardiologist. I worked with men in high blood pressure in Baltimore, and our service worked with over 152 men. And so CHWs, they render direct health services, collaborating with medical professionals. So they're a colleague and a part of the team, not a separate feel-good community person that sits on the side and doesn't really work alongside with the providers. They are able to have access to the health records. They are able to work with providers on case conferencing meetings and do case finding for their clients, but they're a part of that model team. Care coordinator manager model. CHWs help people with complex health conditions navigate healthcare systems. So you will see this, this is one of the models that is up and coming now within the hospital system, looking at things like working on minimizing hospital stays, the 30-day mandate that we have now for Medicaid, but also understanding how to get people to know when to call the doctor, know when to use urgent care and emergent care, so we have minimizing costs across the board. Health educator model. A lot of community health workers, they deliver education to a target population about a particular disease or about information. So right now we're seeing a lot of CHWs who are on the ground delivering proper information about COVID-19, how families can protect themselves, helping to dispel the myths, providing the right information from the CDC, from reputable sites, getting people to understand what they're hearing on social media is not necessarily what's happening. And so CHWs have been shifted to really provide the proper information for families to take care of themselves. Outreach and enrollment agent, similar to a health educator model, but greater outreach and enrollment. So you'll see this as a role for community health workers who are doing street outreach. And street outreach could be for any reason, particularly assessing people maybe who are homeless, who are dealing with mental health and substance use, who are not able to connect to a health system or service, but they're providing information to connect people to services and to systems that they can be a part of to help them manage their disease. And community organizer capacity builder model. CHWs promote community action and build community support for new activities. And so along with their role as working with individual clients, they also are integral in sitting in and part of maybe community health meetings, legislative advocacy that may affect their communities. So they need to be aware not just how individuals are living and what's happening in their communities, but what's happening for the community at large, what's being affected, what public health processes are being put in place, or what things will affect the community coming down the pipe. So I just did a quick overview of who and what a community health worker is and the scope of practice. And I just wanted to stop here. Kelly, did you want me to keep going? And then we can ask the questions at the end. Did we have any?
Yeah, you can keep going. I think some of the questions are more about how do you become a CHW. So I think that's probably a good end discussion.
Okay, not a problem. All right. Community health workers in the mental health system. So, models of care that we see that incorporate community health workers in mental health interventions. CHWs can conduct outreach to facilitate entry into provided settings, a role that has been described as a bridge between. So that role and that as a bridge or liaison between the community and the health system, CHWs can connect patients. A lot of community health workers that I work with we know that they're not licensed, they're not trained in psychology or any type of psychosocial aspects of living. But what they are trained in as community observers, they are great observers. They are to listen to what the client is telling them. They are to observe what the client looks like, is going through, has the environment changed, their affect, and what they do is they take that information back to the health system that they work with, and they work within that health system to say, you know what, Mr. Johnson wasn't himself today. He didn't look right. He was disheveled. He was speaking a little differently. He appears to be sad. So no diagnosing, but bringing a lot of information that will help the other health providers understand that maybe Mr. Johnson needs another level of care, and that CHW knows within that scope to hand off that information so that the next level of care can be incorporated. They can provide auxiliary support for mental health treatment, delivery through case management and promotion of patient adherence to treatment. So if a CHW or a community health specialist is working with the provider around a mental health issue, they have the ability, because they have that trusted relationship, to maybe see a little bit more than what the client may be telling the provider, because they can do it through home visiting, more frequent contact, they spend more time with the client, and they can look at those and make those observations and connect that patient to the right treatment. They can also promote things like motivational interviewing to increase their patient adherence to treatment. Within a step care role model, They can also provide lower levels of care to patients with less intensive needs, while mental health professionals provide that higher level of care, as I said before, and to the patients with more severe symptomology. So if there are other underlying things that that patient is going through, whether they're having a depressive episode or if they're bipolar, what are the other underlying things that may exacerbate those issues? They can help mitigate and address those barriers to helping that patient deal. So you may have the psychologist or psychiatrist promoting and working at that higher level, but the community health worker could be making sure that the person's housing situation is appropriate for them, dealing with what they're dealing with. They can make sure that they're able to get the proper food and medicine, that they have access to the medicine and the medicine that they need to be able to manage their mental health issues. So those are the other lower level care, but important levels of care that CHWs can incorporate when working with providers in mental health. And can also be responsible for delivery of mental health services as the sole treatment provider. A lot of times CHWs have been that person that if there's a crisis, they've been trained in understanding the right questions to ask to get them to the immediate emergent care that they need. And so when we talk about CHWs in the pandemic, so we talked about the scope and the role, and realizing that within that scope and role, no matter if it's a diabetes or if it's depression, a community health worker can be an intricate part of helping that person manage the holistic role of who that person is within taking their medicine, within adhering to treatment, and understanding what are the goals that that person has set for them to thrive, to not necessarily succumb or not have a quality of life, but to support and build a quality of life within them managing disease. And so one of the, we recently at IPHI had the wonderful opportunity to start a webinar series. We started immediately in April because we had a lot of community health workers whose jobs have changed. Because of the pandemic, COVID-19, they are now being shifted to doing virtual, over the phone, and they're also being shifted to really trying to provide the best care for their clients, already dealing with their regular health issues, but now how do I manage this within the context of my life and my family now that that COVID-19 is in place? And so whether you're staffing a call center, translating information, connecting clients online, feeding the hungry, collecting data, educating the community, or advocating for change, we echo, this is the U.S. Department of Homeland Security, identifies community health workers as essential critical infrastructure workers during COVID-19 response. So for us as the organization who hires CHWs, our CHWs have been able to transition, still helping to manage and support their current client systems, but also have been incorporated things like making sure that clients understand the right information about protecting themselves and their family, how to shelter in place, connecting them to food resources and financial resources if any of their clients have lost their job due to COVID-19. We are now developing contact tracing trainings, particularly for CHWs. We know that the states are gearing up and having that as a process of mitigating the spread. But we want to make sure that the community health workers who are already entrenched in the community, that relationship is already built. It just inherently makes sense for them to be a part of the contact tracing training and development that's happening to hopefully lower the spread of the disease, of the viral submission. They are a unique frontline public health workforce that has helped ensure continuity of function critical to public health and the economy. This workforce has been around for a long time, but when we look at how healthcare has changed and how our globally or just within the states, how things have changed, we need to look at other health interventions and professions that really speak to the communities who are hardest hit. And as we've seen in COVID-19, and with any type of an epidemic or chronic disease pandemic that's been around, the communities of color, marginalized, communities having in poverty, communities who are immigrants or undocumented, speaking another language, are the ones who have been hardest hit, who are dying the most prevalent. These are the communities that CHWs work and thrive in, and these are the communities where they come from. Today's COVID-19 community health workers could become epidemic response corps in the future and always ready to help us in that epidemic. So here are some roles that we can look at CHWs when we talk about helping within the epidemic. So one of the key things that they do is they support inherent resilience. So they increase the access to health services and products within the communities to improve public health and reduce likelihood of the outbreak. They communicate important health concepts in a culturally appropriate fashion. If they need to take the materials, which may look like a lot of words, but understanding that a lot of the community people may not read, have literacy issues, not just language issues. CHWs know how to make that information come alive with videos and graphics and to sit down and explain information, and they have the time to do it appropriately in a proper fashion. They reduce the burden felt by formal healthcare systems and improve the quality of clinical care. They are able to help people really understand and navigate the system, get them ready for their appointments, help them keep track of their medicines and information for their appointments coming up. They role play with their clients on their next appointment to the provider so they can get the most out of their visit. But then there's also adaptive resilience. Community health workers act as community-level educators, organizers, and mobilizers during infectious disease outbreaks. They're already on the ground. So the organizations will equip them with the right information, understanding how to help people when it comes to understanding connecting to testing. If someone within the home does become positive, how do you help the family understand sheltering in place versus isolation and quarantine? They help understand these processes for families who normally won't get this information from the regular healthcare system. They contribute to disease reporting systems like contact tracing, as I said before, and health department monitoring. And they complete medical tasks unrelated to infectious disease outbreaks in the filling health service gaps during or following an outbreak. So there are a lot of opportunities right now while we're in the midst of the outbreak that community health workers can be key and invaluable to helping people where they are, but also minimizing the spread. The importance of pushing that social distancing. A lot of our CHWs now are really challenged, and they said, you know, I'm trying to make sure that my community understands how important social distancing is. But when you're part of a community that loves to connect, that can be a little difficult. But they're persistent in trying to support them in ways and making sure that people have masks, that themselves as CHWs have had challenges from the healthcare systems that have hired them to have PPE. They are still out there, some of them on the front lines, and still visiting and going to communities' homes. So they need to have the same type of measures in place as a provider so that they are safe. How CHWs are critical in minimizing the spread, providing the correct information, dispelling the myths, just getting rid of the rumors, sticking to the facts. One of the things that we did immediately when this happened, we provided our CHWs with a frequently asked question sheet. And we pulled the information from the CDC and the World Health Organization. So when their clients did have questions, they all, number one, had the same messaging. Number two, and they had the right, correct messaging to address clients' concerns around COVID-19. Provide them recommended ways to stay safe. Support the clients in making their own masks. Provide resources on cleaning and sanitizing their homes. And advise clients to create shelter-in-place plans and to locate resources. Use the language that supports their literacy level. And sometimes in situations where people are dealing with the unknown and fear, they can get to want to cross boundaries and barriers because the CHWs are there to help them. But community health workers themselves also have to practice self-care. And in saying no, or I don't know yet, but getting back to a client sometimes will minimize stress and burnout of your community health workers, but also helps mentor the community and understanding, the support is there, but you got to, understand when you can and when you cannot, and supporting the clients as needed. They also build relationships and work as teams. Local community centers, health ministries, health departments, and social services agencies all either connect with agencies that have community health workers or employ CHWs. So they're a part of these teams already. They know the neighborhood and how to help clients navigate the resources. Help keep them calm by having them culture of humility, get to the real reason for the fear and mistrust, be a listening ear, be empathetic. One of our series that we had for COVID-19 and community health workers, they wanted to know, they were stressed. They were stressed themselves because they wanted to do more. They weren't sure what to do. They knew that they couldn't do too much so it wouldn't affect their families. And so we actually had a psychologist come on to answer their questions around helping their clients, but also supporting them in the field as well, and having that work-life balance and feeling safe to be able to do their job. CHWs encourage people to talk to their healthcare providers all the time. They don't think of themselves as the end-all, be-all. They are connected with either their providers or they are dealing with messages. When clients have clinical and medical messages, they don't try to solve it for them. They encourage them always to connect to their provider, either try to call them, make an appointment, and now that providers are virtual, and if clients have the infrastructure to be virtual with their doctors, to be able to ask the right questions during that time. They encourage those who are expressing signs of anxiety, stress, and depression to seek mental health services. So they are really pushing that. It's important that when your stress level is high and you're not able to function on a daily basis, they are really supporting clients to seek mental health services, preferably free services, low cost within their insurance, or what is being provided in their neighborhood. They encourage clients to have a checklist that has access or copies to them of their medical records, pharmacy records, any photos of important documents. They're preparing them to have the important information that they need while they are sheltering in place. And they talk with family members and loved ones about how they would be cared for if they got sick. So they're also working with families who, again, I said before, if a family member does get sick, what happens? What is the next step? How do we separate? We live together. How do we have them quarantined while we're staying in the same home? Is there a facility that they can stay in if they're not being hospitalized? And one other thing that I don't have mentioned here is they are really supporting people getting tested. When they are doing phone assessments or home visit assessments and people have certain symptoms, they are encouraging and navigating people to testing sites, making sure that their providers are giving them the prescriptions and the letters to be tested, but knowing that testing is so important and not waiting until it's too late. CHWs advocate for individuals and communities that might not have the money or resources for medical treatment if they get ill. Where can they go? Are the clinics that were open before still open, who were free or sliding scale? Who's providing a triage or some type of help within not just COVID-19, but existing health issues that they've already had? Encourage elected officials to invest in public health infrastructure before a pandemic arrives in your state. So we are working. There's a National Association of Community Health Workers, and there are several organizations like ours, IPHI, who are partnered together across the country and who are looking at developing new state and United States mandates for incorporating CHWs within the pandemic, for understanding the role, to invest in the infrastructure. Some CHWs are paid, but usually not paid the best. They're the lowest on the total poll when it comes to salaries. And you have some CHWs who are doing phenomenal work and who are volunteering. But these CHWs also have families. They have medical issues and they need to eat. So if we are asking for this workforce to support an infrastructure to help mitigate a pandemic, we need to ask for a workforce who are getting livable wages, who have access to health care, good quality health care themselves, so they can continue to have a quality of life to help others. And they keep up to date on what's happening with the following with the CDC and the World Health Organization websites about COVID-19 and providing the proper information for their clients in the community. So CHWs and contact tracing. Again, community health workers are a proven solution for boots on the ground need for contact tracing. When properly trained and protected, they can be possible door-to-door assessments and can be so critical in containing infectious disease breakouts. They can collect information on symptoms, progression of the infection, patient-reported outcomes, contacts, and other data at the level of detail unattainable by other means. When you have people who are already connected in the community, who have built that trust, who people are aware and know about, who have the skill and savvy of building that rapport, it's easier to get into the community and get these questions and this information than having someone coming from an institution which a lot of people may not trust or know, and bringing in workers who have no clue as to how to be empathetic and non-judgmental in a lot of community settings. Community health workers can also deliver test kits, transport samples to labs, distribute educational materials as well as medicine, food, and other essentials to those who need them. So that is the end of my presentation. I hope my information was very helpful in understanding who and what CHWs are and the different roles that they play within mental health as well as a pandemic, and understanding how to hopefully learn to incorporate them within your practices, or that you're working with them and understanding how they are trained and what those core skills are for this integral role.
Awesome. Thanks so much, Dwyan. I have some questions, and folks who are listening, feel free to also keep asking questions. So one of the questions that we got, which is a bit of a long one, is how are CHWs different from like a navigator, a peer recovery specialist, a certified peer specialist, or an intensive case manager? So how are CHWs distinct from those many of the roles that are emerging or have existed in mental health specifically?
So two things. Those are specific titles that either organizations or programs or the disease state that utilizes for the role of CHWs. Not all CHWs are peers. So peer recovery specialists are a type of community health worker, but not all CHWs are peers. So that's like having a specialty CHW. So it's not that much different. The other thing is, remember in the beginning, these community health workers are either trusted members of the community, have a unique or unusual relationship, and the level of education, we're not asking for a lot of degrees or specialties. Usually the minimum is a high school diploma, but realizing that the person's lived experience. So some of the titles that you mentioned may or may not have all of that, but are still titles that can come under the umbrella of community health worker.
Okay, next question. So someone said, my staff has operated as community health workers. We call them community health leaders. How do I get them involved with COVID-19 support?
Okay. I think the first thing you would do is understanding what the clients need. So if your staff are doing community health work, but you want to get them more involved with COVID-19, find out from the community health workers to do a quick assessment of the clients that they're working with. And the quick assessment can look like this. How are you doing within this pandemic? What have been your concerns? What have you needed? And just asking where the clients are right now. From that, just like any other area of dealing with a health issue, they should get information from that assessment to understand what their clients need. So we can make assumptions what they need, but I think individually having the CHW should just do a little poll, an assessment to see where people are. What we found that a lot of need is coming from food insecurity. So I can say within D.C., Maryland, and Virginia, a lot of people have been laid off, and they're not knowing where their next meal comes from. We've also had issues, particularly in Maryland, where we've had people who have been asked to work who have symptoms and have been threatened that they didn't come to work, that they would lose their jobs. So there are some critical areas that community health workers can do some assessments to find out what is happening in the community, and then based on what is happening, connect to the resources. Develop a COVID resource guide. Work within the churches and the community resources that are already existing there who are helping people through these times. There in Maryland, D.C., and Virginia, they all have community health worker associations. I'm not sure where that person is, what state that they're in, but they're connected to community health worker network or association within the state. You could start there. If there is an association there, to find out what is that association is doing to support CHWs helping the clients through COVID-19. And checking with the hospitals, checking with the federally qualified health centers, checking with other CHWs who are working in other clinical aspects to see what other areas that your CHWs can support around things like food access, testing, making sure that people have the proper means of cleaning their homes, making sure people have the necessary things like toilet paper, paper towels, understanding that people may have lost their income. Do they need to navigate to actually get the stimulus? Are they applying for unemployment? Do they understand the process they have to go through that? But that comes first from assessing from the clients what they need. Okay?
Great. Awesome. So let's see, next question. How are CHWs different from lower-level social workers? It sounds like many of these roles of CHWs are already done by BSWs or non-licensed social workers.
The one thing I can say is not all lower-level social workers or BFWs represent or come from the communities that they work with. Okay. Not to say that they don't, but most likely there's not a requirement educationally like you would a lower-level social worker for a community health worker. You can pull somebody straight from the community and train them with a high school diploma or a GED. Sometimes community health workers, depending on the communities that you're involved in, a lot with the Native American and Latino populations in a lot of states, they don't even require that. They just require that you are part of the community, you understand the language, that you have a sense of culture, humility. So there's an educational requirement for the role that she speaks of. Some organizations don't have the educational requirement or limit. I know within the region, D.C., Maryland, and Virginia, the minimum is a high school diploma or GED. But the key to a community health worker is that lived experience, that shared understanding from that community. Not necessarily you have to live in that neighborhood, but if it's someone that you find in the community and they've had cardiovascular issues, and you have a project that's working with someone with heart disease, some type of connection with the community. They're actually going home in that community. They're not going to clinic, and they're not sitting at a desk all day and seeing clients maybe in a clinical setting, and then going somewhere that's different from the communities that they live in. These are people that are from the communities, that share that lived experience, and we're not looking for certain types of educational levels for community health workers. And the CHWs, not to say that social workers don't, but a big part of how they operate is strength-based approach. They look for what's strong and not what's wrong. And usually when CHWs explain their role and who they are, it's different. It's a different feel. When you come as a social worker, most clients will be like, okay, are you taking my kid? Are you making me, have to show up for this? There's assumptions about what social workers are going to have people to do when they show up for like home visiting and things like that. For a community health worker, the role is to teach people to take care of themselves, but understanding that in doing that, they've already had that unique connection and have the unique ability to build rapport.
Thanks. Let's see. Another question is how can someone become a CHW?
Sure. So that's tricky, depending on where you are. First thing I would do is, believe it or not, since I was a CHW, there didn't used to be a lot of requests for CHWs like on online work search engines. There are a ton. So I would definitely Google community health worker employment positions, see who's hiring, and look at the job descriptions. But if you want to hire a CHW, a part of that is looking for people who are already working in their communities, maybe part of their church ministry. They're already like that natural helper in the community, that mom and pop that knows the kids, that watches out for the seniors in the community. These are the people that non-traditional types of people that you will really want to look for, because they're the ones that have already decided for themselves, I love my community, I have a compassion, and I want to do what I need to do to help them. And what you're going to do is take all of that, and then you're going to provide information around those core competencies that we talked about and help them to understand how to utilize those types of core competencies around what they already have for their community. So that CHW that you hire, when we do hiring, those are the things that we look for. Have they had some type of experience, not necessarily the CHW, but are they a part of their community? Are they on their community board? Do they attend church in the community and do volunteer or do food giveaways? Or have they already been that person in the community where, for instance, I always give an example, in some communities there's this lady called the Candy Lady. She is the lady that has the house usually in the middle or on a corner. She's selling the not-so-nutritious treats and the freezy pops. But this is the woman who is home during the day. She's watching when the kids go home. She makes sure they cross the street. She knows the seniors in the community who she can actually, she may be taking them to their appointments. She's watching to see if there's intruders in the community, in the neighborhood. She's the one that attends the community board meetings and goes to the legislative meetings, who advocates for her community. Those are the people that you really want to look at in hiring as community health workers. And then during the hiring process, have scenarios set up. So yes, you have your regular questions, but you want to make sure that you have scenarios set up to understand how they would handle certain situations. And look for things like empathy, non-judgment. Look for things like understanding people and meeting them where they are. Look for that culture of humility even before you train them on that. Look for things like that they're already aware of certain resources, that they know that down the street that there's a food pantry at the little church that a lot of people may not know about. Those are the people who make excellent community health workers. Then once you provide the training, you're off and running, because they've already brought the much-needed lived experience and are part of the community that you need.
Awesome. Thank you. We have a lot of folks sharing different resources and saying thank you. For folks on the line, we have about 5 minutes left. I haven't seen any new questions, so feel free to ask them. Let's see.
Yeah, and I want to add to that also. If within your state you find a community health worker association, that may be an excellent place to attend a meeting, to talk to the leadership at the association, and usually the association is headed by and for community health workers, and they can steer you in the direction of CHWs who, unfortunately, their funding may be lost, but you have a lot of seasoned and trained CHWs who may be looking for employment. So do the associations and the networks as well. And then also there's the National Association of Community Health Workers that's been developed. I would definitely go to that website. They are doing wonderful things around supporting states and regions to fully incorporate community health workers within the health system. They have an actual separate huge page on COVID-19 and how to incorporate community health workers in working in COVID-19. They've been having webinar series like us for the past month, and we are actually continuing on our webinar series. Our last week we did immigrants and undocumented, and how to support them within COVID-19. Actually, earlier today, we did a session on people living with HIV and how to support COVID-19 and utilizing ADAP as a resource to support people in getting their medications.
Great. Would you be able to share where folks can find those events?
Sure, I definitely will.
Okay, great. Let's see. Okay, well, I don't see any additional questions, so let me turn to the next slide. So I have Dwyan's contact information, and wanted to just take this time to say thank you for an awesome presentation. Folks in the comments have really enjoyed it, and we've gotten a lot of really awesome feedback. For people on the line, the recording and slides will be sent out via email and available on MHA's website in the next few days. And yep, just wanted to take this time again to thank you all. Thank you, Dwyan. This has been really great. And happy, really excited to share this, especially because it's so crucial right now.
Yes, thank you. Thank you for the opportunity. I'm glad I was able to provide some information and insight into the role. Please feel free to email me. I get back to folks on email. I'm a good stickler about that and making sure I answer any other questions or information. If you need community health workers trained and you're in the region, please, by all means, connect with us, and we can see how to help with training, not just the CHWs, but also training supervisors and health providers and how to utilize and work with community health workers. And we actually also provide technical assistance and infrastructure development for organizations who want to bring on CHWs. So yes, we are a invaluable resource and service for you around community health workers, as well as other public health issues as well.
Awesome.